Okay, here we go. Hello, everyone. This is Jean Birchman, and we are back with Dr. Queally for our second in our speaker series for October Spina Bifida Awareness Month. Dr. Queally is an assistant professor of psychology in the Department of Psychiatry at Harvard Medical School and is an attending neuropsychologist in the Department of Psychiatry at Boston Children's Hospital. She's worked in the Center for Spina Bifida and Spinal Cord Conditions at Boston Children's Hospital for the past 15 years and chaired the development of the standards of neuropsychological care for patients with spina bifida. So we are very fortunate to have her with us this morning and sharing some information about executive functioning skills and how to manage all of the complications and that go along with that. So I will, without further ado, turn it over to Dr. Queally. Thank you.
Thank you so much, Jean. So my goal is to go through some of the changes that we would expect to see and hopefully share enough information that you guys are able to kind of hit the ground running. So the goal is to go through how changes in information processing and executive functioning skills can undermine learning. And she just ran through this, but this is where I spend the bulk of my time. The objectives for the presentation today is for us to go through how the changes in information processing style affects learning and how it can limit the engagement of executive functioning skills. And then how these challenges actually can shift the learning process for many patients or children with spina bifida. And then we'll talk a little bit at the end about how some of the educational changes that have happened secondary to COVID have affected our ability to access the learning supports that we need. So I don't have any conflicts. So I wanted to start with a description of the typical neurocognitive profile. And on each of the slides, if you can see, there's a title at the top, and then when there's the little colon right underneath it, I've tried to provide a definition of what that means. So I want families to understand what the words are that we use, but I want them to be accessible and meaningful. So a neurocognitive profile is important because that tells us both the potential strengths and potential weaknesses that we typically see with a medical condition. There's no be all and end all. So it's not always, it's never always, but there's an often. And typically when we have enough research to support the often, we know what we're looking for. We can provide information to families on what to expect, and we can provide better prognostic information. So there's changes over time as treatment changes, okay? But if we do see changes in brain structure and going forward brain development, they can have lasting changes in brain function that we would expect to see over the long haul. And some of these differences for different medical conditions are due to changes in brain development, and sometimes it's the actual treatment for different conditions. So for example, with spina bifida, we see underlying changes in brain structure development before we're born. And then after we're born, some children develop hydrocephalus, which then needs to be treated with neurosurgical intervention. And so as you get older, there can be other potential complications like a shunt infection or recurrence of hydrocephalus that can again change the underlying structure of the brain, and therefore the development of skills after those changes in brain development have happened. I do want to say today I'm going to speak more generally about spina bifida. We tend to see some of the same strengths and weaknesses for patients who have not developed hydrocephalus. We have a lot of patients now who are not treated for hydrocephalus but do have changes in underlying brain anatomy or the way the brain is structured. And so I'm going to talk more specifically about what we see with some of those different medical conditions, but we're also going to talk more globally about the typical kinds of strengths and weaknesses that we see. I think one of the things that's most important is that I don't want for families to feel like we're just looking at the weaknesses. It does not help anyone to just identify deficits. You really have to think about the strengths that patients have, that children have, and how we use those strengths in order to continue to build skills. So the neurocognitive profile, like I just said, doesn't reflect all of the strengths and weaknesses, but most commonly linked to the medical condition. And one of the reasons this is most important is that we still inherit strengths and weaknesses from our families. So I will sometimes be halfway through a feedback session when a parent will say, oh, that's what happened to me in middle school, or I always had those problems too. And what we'll see is layers of risk. So there were layers of risk when you were conceived and that you inherited from both of your parents. A strength in reading, a potential deficit in math, more challenges with visual spatial skills, etc. And then on top of that, there's an additional layer of risk secondary to the medical condition. Okay. And our knowledge of these profiles is always emerging. So I think at this point we have a pretty good handle on what we would expect to see for patients who have shunts. But now that so many of our patients are not being shunted, we're seeing some differences in development over time, but we don't have the 20 or 40 years of experience to look back on to say how these patient populations will age differently and how adult development may be different for them. So what do we expect to see for patients with spina bifida? Almost universally, regardless of hydrocephalus status, we see stronger language processing skills and more deficits with visual spatial reasoning. Some of this really goes back to early delays in motor skills that seem to undermine the development of visual spatial skills, as well as other changes in the way that the brain develops. The current IQ test that we're using for children ages 6 to 16 parses reasoning skills into 3 different domains: verbal reasoning skills, visual spatial reasoning skills, which has traditionally been a pretty significant split for most of our patients with spina bifida, with stronger language skills. But there's also a domain that looks at visual reasoning skills. And these are often visually mediated tasks, meaning you're looking at pictures, but you can use language to help solve them. And so for most patients with spina bifida, they have stronger language skills. They do okay on the visual reasoning task where they can use language to solve those problems, and they have more deficits with visual spatial skills. I think one of the other things that's significant about spina bifida and different from some other medical conditions is that there's a lot of variability. Even if patients have the same profile of strengths and weaknesses, many of our patients score within the average to high average to low average range. But some of our patients are much more significantly affected by their medical condition, which does affect their cognitive development over time. And then we do have several patients that are very high functioning and are scoring exclusively above the average range for age. So we can sometimes see these neurocognitive profile aspects of strengths and weaknesses, regardless of where they land on the continuum. But spina bifida, more so than other disorders, does have a lot more variability. We also universally see slower information processing speeds, especially when tasks become complicated. So when we're trying to do multiple tasks at the same time, or there's a motor production component, meaning we have to write something out or we have to manipulate items with our hands. At that point, we'll see that the task becomes significantly slower than other kids their age. So even if we can reason at the same ability level as our peers, we sometimes take more time to get tasks completed. And for a lot of students, individual or kind of internal discrepancies between their strengths and weaknesses, even if they're relative, meaning they're within the average range, you have a relative strength in verbal reasoning that's 10 or 15 points higher than your relative weakness in the visual spatial domain, even if they're both considered to be average. Most of our children, especially once they hit adolescence, can report that they feel that. They know they're better at some things than they are at others, and they can't often pinpoint why or what to do about it, but it feels uncomfortable to them. And so it's not all about where the scores fall, which just makes it even more challenging to try and help your child kind of navigate through all these different learning experiences. So in terms of specific strengths and weaknesses, some of the things that we see is that vocabulary is often premature. We have stronger vocabulary than other young children. They're often advanced vocabulary words. They spend a lot of time hanging out with adults and pick up their vocabulary quite nicely. So they often present as quite precocious as toddlers and preschool age children that have a lot of words. With memory, they do great with experiential learning. I can have kids tell me, like, 4 years ago when I went to Disney, I was wearing an orange shirt when I met Goofy. And the fact that they can remember these little facts about their life and their life experiences is amazing. We tend to do very well with routines. Socially, patients with spina bifida are often described as very friendly, they're outgoing, they interact well, easily with adults. They're friends with everyone. They're often called the mayor of their school system or their elementary schools. And with academics, reading fluency is often strong, word identification is often strong. And they tend to do better in social sciences. So class domains that are mediated by that reading and verbal reasoning skills that they tend to be stronger at. The typical neurocognitive weaknesses that we see are with information processing. There's a vulnerability to processing load and complexity. And we see deficits in executive functioning skills, which follow the information processing deficits. So if you're overwhelmed by too much information at one time and by complex information at one time, it can be really hard to get started on a task, or to integrate information and pull it together, or to organize all the information that you've been given. With attention, while we can maintain attention effectively, we often see difficulties switching between different tasks or dividing attention successfully when we're able to work on two different things at the same time. Visual spatial skills, particularly mental manipulation of visual information. The best way to describe this is if you follow a map to get to someone's house, your ability to invert the map to get back home would be mental manipulation. To be able to mentally move around information kind of in the space in your brain to figure out where it might go best. Like if you were rearranging furniture, that you could figure out you could interchange two different pieces, or putting together any piece of IKEA furniture that comes with absolutely no verbal instructions at all. Motor skills, we often see challenges across the domains, and a lot of this is secondary to the changes that we see in the development of the cerebellum. So fine motor skills are things that you do with your hands, being able to manipulate objects, feed, get an item or a shirt buttoned or snapped. Graphomotor skills are things like writing, written production, typing. And then if we look at gross motor skills, that has more to do with how your whole body operates and how effectively you can engage with your environment around you. And with academics, we often see learning challenges in math, writing, and geography. And those topics specifically have a lot of visual spatial reasoning included in them, which increases the challenge. And we often see difficulties with the application of academic knowledge. So we'll hear a lot that kids know how to do something but aren't able to do it on demand. In terms of development over time, and we did get a question about this before the presentation, we do not expect for the changes in brain development to undo themselves or to repair themselves over time. It's not something that with the current medical technology that we're able to do. We are able to alleviate some symptoms that can cause an increase in problems at times. So if you're experiencing hydrocephalus, your brain is not going to function as well as when you're not experiencing hydrocephalus. The neurosurgeons can relieve the hydrocephalus pressure, but they can't go back and change the underlying changes in structural development that have happened. So we don't expect for these things to change in profiles. That being said, we do expect for kids to pick up strategies over time. We expect them to learn different methods of engaging with their environment and to be more effective learners over time with more exposure to learning tasks and specific strategies that can help them. The slower processing speeds, though, can be really challenging to manage. There's not a lot about everyday life experiences that we can dramatically slow. And because of the fact we can't slow down the environment, part of what we have to do is to self-select things that work at a slower pace. So being an emergency responder, like a policeman or a 911 dispatcher, is not a great career trajectory for someone with slower processing speed. Now, does that mean they can't be in a helping profession where they provide assistance to other people? Not at all. It just means we have to think about how efficient we are with our processing speed and our motor response speed. This also does affect driving, which I'm not going to talk a lot about today, but it's something to keep in mind. Although these changes in processing styles are permanent, again, over time they can improve once they learn strategies, and we can create environments that are more supportive. And one of the things that I talk a lot about when I'm meeting with individual patients is learning to prioritize what's most important to you, both as a child and to the family structure. So if learning 2 languages is going to slow down language development, but that's important to your family, then you learn 2 languages. You don't postpone that until the child's 12 or 15 or 20. You teach it in early development like you would for any child. But if it's not important to you, then perhaps learning a second language when they're in 8th grade is not a good use of academic time. These are individual decisions that families have to make about their child's development. But if we work at a slower pace, something usually has to give. We have to give up something that's on the plate that everybody else is trying to learn. So what are information processing skills and executive functioning skills, right? This is very trendy. Executive functioning skills are everywhere. There's a lot of magic ways to improve them if you read a certain book on the internet or hire a certain person to work with your child. But one of the things we know about spina bifida is that those executive functioning skills are chronically undermined by the information processing style that most of our patients use. And so I want to talk a little bit about that first. That'll help us better understand the executive functioning skills and why some interventions are not as effective. First, though, if we're not paying attention to our outside environment, it's very hard to take in any information. So attention is much more complicated than most people generally tend to think of. When we talk about attention, we're usually referring to one's ability to stay focused, right? So that's what we say about our kids, like they're paying attention to the TV and they're ignoring me, meaning they're focused on the television. Attention in the way that we assess it as neuropsychologists is a little bit more subtle and nuanced than that. So there's multiple factors of attention that we're really looking for. Can they focus? Can they maintain focus over time? What becomes distracting and when? Can they divide attention? And can they shift attention when necessary? So if they're watching TV and the smoke alarm goes off, will they get up and move? If mom says dinner's ready, will they get up and move? These kinds of issues. So for most children with spina bifida, focusing tends to be quite easy. They're able to focus on things that make sense to them, and they can often maintain focus quite well, but they have a really hard time shifting. So if they're working on a worksheet and the teacher says it's time to move on, they sometimes do not hear that information at all. Dividing attention can also be very challenging, and that goes back to that multitasking piece. And oftentimes, if attention is a problematic system for this child, it's most often inattention rather than hyperactivity. So we do have children who are diagnosed with ADHD. It's not every child with an attention problem. ADHD, usually etiology-wise, is a familial disorder. So if mom or dad has an attention disorder and the uncles and aunts have an attention disorder, then we will frequently see an attention disorder in the child as well. It's just another layer of risk that's increased by both family history and the spina bifida. We do not have good evidence, though, that medications work for these attention problems unless it's a family history of attentional disorders. I also, and I'm going to come back to this later, but I want to make sure that we are also clear that sometimes we are distracted by information that we understand or makes sense. And we might ignore information that does not make sense to us. So one example I'll often give to parents is if I dropped you off in an astrophysics lecture at MIT, with the few exceptions of our parents who are quite bright and work in that engineering field, most of us would have an attentional disorder in about 30 seconds and be staring out the window or looking around for something that didn't make sense to us. So the failure to maintain attention is not in itself an attentional disorder, but it often reflects our ability to understand our environments. So what is information processing style? That's how we take in information and begin to understand it. So some people are more gestalt or big picture thinkers, and some people are more focused on details. And I would say almost universally, I see that most children with spina bifida tend to be very focused on smaller details. They break apart moderate to lengthy bits of information and they focus on small little tiny parts, and they tend to go in a linear fashion, meaning they're focusing on bit in order. Now this allows us to be much more effective and accurate because we're looking at a sentence, we're breaking it apart into little words, or we're looking at a math problem where we're breaking it into little numbers. But it can at times undermine our ability to understand the material. Memorization for content is often a strength. So if we break something up into small little bits and we can memorize it, it often looks at the start that we're doing great. We understand information, we've learned it effectively, and we can repeat it back to other people. But if we're not actively processing the information as it comes in as active learners that are engaged with their environment, and we're just passively memorizing the information, we're easily overwhelmed because no one can memorize 30 bits of information or 50 bits of information. But if you can process information and chunk it and organize it, then you can take 50 bits of information and make it into 7, right? And that's how most people start to process information. So let me give you an example. If I started to give you a phone number, we're in Massachusetts, if I started to give you a phone number and said, well, the number is 355, which is like the hospital exchange. If you're a patient at Boston Children's Hospital, you've already forgotten the 617 and just remembered that it's Boston. And you've forgotten the 355 because that's the hospital exchange. And so all you have to remember is that it's at Boston Children's and the last 4 digits of my phone number, which is usually within most people's wheelhouses. They can remember around 5 to 7 bits of information. But if you're not actively processing the information, when I say 617, you're memorizing those as individual numbers. And then once I get to the 355, your memory system's full. And you can't remember the last 4 digits that I'm going to give you of my phone number because you're not actively processing the information. You're just memorizing it. Now, I'll often hear that people understand things only if they like them or they're familiar with the topic, and that does make sense because if you know the Boston area, the 617 is going to have more meaning for you. And so that happens with everyone's brains. It just feels more salient for some of our patients because of their processing with novel or new information. So again, this kind of linear information processing style, the kind of piece-driven, kind of bit-by-bit processing, it creates a large amount of risk for large information processing loads. So if I read you a paragraph rather than a sentence, and even if we're capable of the information and comprehension integration piece that has to happen at the end, we really need extra time to do that because we need just as much time as everyone else to listen to and memorize the information. So because of that detail-oriented linear processing style, our approach to the environment is often slower. We get more details and we miss the broader concept. So if we hear a story, we remember little tiny details or the exact wording of some portions, but miss the bigger meaning. Information tends to be fragmented as it's memorized and not comprehended, and it's concrete and less flexible. So it's harder to build on later if you've just memorized a bunch of little facts rather than a general understanding of the information. This also leaves us to be much more reliant on routines than novel problem solving. So if we can only take in bits of information, we have to look for something that identifies it as familiar, and it's usually something that's memorized, and then we know how to do it. So for example, I'll see sometimes the patients will work on a math problem, and if I list the problem sideways or horizontally instead of up and down, I'll have patients tell me they don't know how to do that because it doesn't look familiar. And if you actually sit down and talk about it, like this is just a subtraction problem in the same way that the other way is, we can set them up differently, then kids get it. But if you don't provide that additional link, kind of helping them to understand how the information's different and to tap into their comprehension rather than just the memorization of the content, we can lose it or they can miss it. I talked a little bit about the familiar topics already. Okay, so how does this affect the executive functioning skills? Executive functioning skills, more so than some of our other skills, are really built on a circuit. So it's not an individual little tiny part of the brain, but it's a circuit of skills that we need all to be working in unison. So if there's one area that's not working as efficiently or effectively, that can take down the whole system. And executive functioning skills are vulnerable for all people. It's pretty easy for us, even as adults, if you're neurotypical or have had an expected development, if you're stressed, if you're sleep deprived, if you're in the middle of a pandemic, you've had 2 glasses of wine, these are like easy ways to undermine your executive functioning skills, your planning, problem solving, multitasking skills. You get slower, you're not able to process it effectively. So if that can do it, if one night's sleep can do it, you can imagine what changes to brain structure and development or a medical condition like hydrocephalus can do to those executive functioning skills. But the other real challenge for kids with spina bifida is that underlying information processing. If the information isn't coming in a meaningful format, it's really hard to garner these executive functioning skills and get started on tasks and work independently. So executive functioning skills are pretty vulnerable to stress. They're interactive skills. They're interdependent, and that way they have to work together to reach a goal. And so some examples to give you a more tangible understanding of executive functioning skills are like starting on a task or switching between tasks or concepts, being able to generate problem-solving strategies, to try something new or different if the strategy that you're working with right now isn't effective, being able to integrate details or generalize information or concepts, and then being able to sequence, multitask, prioritize information. So if you come home and you have homework from 4 different classes, which one do you do first? Which one's more efficient? Which one should you do before dinner? Those kinds of things are really hard if you don't understand the task demands, you don't have a good understanding of your own skill set, and you don't really know what's going to be expected of you as you're completing the task. So for children and adults with spina bifida, they often have a lot of difficulty identifying task demands unless it looks familiar. So unless there's those little triggers of things that they already know, where they hit the familiar word and they're like, oh, I know how to do this. Oftentimes that really stymies what we call independent initiation or switching between tasks. They're not willing to get started on the task because they don't know how to do it. It's not because they're non-compliant. But this increases the need for support in the environment. We really need more people to be on top of us, to give us guidance and pointers and encourage things if we're not really quite sure how to get started. You can't wait 20 minutes because at that point your class is half over. Because of like the really strong rehearsal memory, we can often have kids that can repeat the instructions but still are not getting started. So I hear about this as a frustrating factor for a lot of teachers where they're like, so-and-so can tell me what they're supposed to do, but they're still not doing it. And it's like, no, they're repeating back your language. They're not telling you what they're supposed to do. So they can repeat your instructions back, but that does not mean that they've already got a step-by-step instructional set in terms of how to engage and how to get started. And we see a lot of difficulties with multitasking and managing information processing load that's higher, as well as organizational challenges. So figuring out what the big picture is pretty hard when you're super focused on smaller details and are memorizing things rather than comprehending. This also directly in turn affects memory. If you're memorizing information and you don't truly understand it, when you store it in memory, it's not in an effective way that we can find later, right? So memory, both when we're talking about memory as a construct, it's both how information is processed and stored in the brain, which is what we normally think of as memory, but it's also the retrieval of memory later on. So to give you an example that I often use with patients, as like when you meet someone in one context and then can't place them when you run into them in a different place. So if you run into a childhood teacher at a child sporting event, like being able to place where you know them from might be really challenging if you don't know them that well, or you haven't seen them out of that initial context in the beginning. And that's because you've stored them as a staff member in an elementary school, as opposed to the woman with the long straight hair or whatever else it is. And those factors, when you're faced with them, are not enough to trigger that memory retrieval for you. So if we're memorizing and storing information, we're not really able to go back later and pull out the information from our memory stores because it's not labeled appropriately. It's not labeled accurately in a way that we can find it. Which is why when we look at that subtraction problem, we're like, oh, this does not look familiar. I don't think I've ever done this before, even though it's just written a different way. So what does that mean the academic profile looks like? It's a concern for a lot of school-age children. So like now that we know this, what do we do? So one of the things I did want to talk about was development over time. The expectations for kids in school develop over time and become more complicated. And so for us as parents or adults to be able to advocate for kids, we need to understand how the domains look slightly different as kids get older. So based on what we know already, rote memorization, working within routines, usually kindergarten through second or third grade, that's what all of school is, establishing routines, going through sequences, memorizing rote facts and early information. Those are strengths. We often look academically pretty strong through early elementary school, but I do start to hear by the end of elementary school that while reading skills are fine, reading comprehension is a huge issue. We can read an entire book or a chapter or a page, and we have no idea what we just read. And in third, fourth, fifth grade, that's really problematic because kids are supposed to be teaching themselves. They're supposed to be reading for content and understanding the information. And if you can't read and comprehend, it really interferes with your progress. So that switch from learning to read to reading to learn is huge in those grades. 6th through 8th grade, in most traditional middle school settings, we see a lot of increases in organizational demands on top of everything else. So keeping track of multiple teachers teaching styles, strategies, demands, and what they need for each of their classes in addition to the content and the content delivery being different, is often hard. Kids don't know their teachers as well, and their teachers don't know them as well because they're only spending an hour a day rather than 6 hours a day with that teacher. So making sure that we can pair them up with the learning strategies that we need can be really important. Mobility demands also become a factor in middle school, not because requiring a wheelchair or crutches affects your ability to learn, but it often affects your ability to be in the classroom for the same amount of time as everyone else. Even just catheterization needs. When kids leave the classroom 5 minutes early to get to their locker in order to make it to the elevator in time, that's 5 minutes every day that they're losing off that class that they need, especially if they're working at a slower pace. That puts them at a bigger disadvantage relative to peers. So it is something that we have to think about. And ironically, is one of the things that we're getting around with some of this remote instruction. And then 9th to 12th grade starts to require more substantial abstract and flexible reasoning skills. So these demands really increase as we get older. With respect to reading, what we typically see is that word identification skills are pretty strong. We can memorize words based on what they look like, and we can recall them pretty effectively. So sight words are often stronger than phonemic decoding skills. That being said, reading comprehension usually winds up being the bigger challenge. So they can read all the words out loud pretty fluently, and they get to the end of a page and they have no idea what they've just read. Because you have to actively process the information in order to develop reading comprehension skills in order to know what's going on. In terms of math, math begins as memorization. So early development of math facts is generally pretty intact, especially when you use rehearsal-based strategies that are provided in some of the classroom. But as math becomes more conceptual, which is required based on the MCAS and requires some additional support for the more applied mathematics that we use in everyday math curriculums and things like that, we do see more challenges. So when there's a complex word problem and it's not laid out what needs to happen or how it needs to happen, we do see more difficulty. And there's a lot of sequential processes that are involved in multi-step tasks, such as long division. And so if we're not great, then understanding how we keep everything in order and what comes next and what tasks we've already done and how to prioritize really becomes an issue. So writing skills also is a very big multitasking demand. If you're going to actually think about what you want to say, articulate all of the words, keep them all in sequence, and then produce them with writing skills that tend to be slower and more problematic relative to peers, you can see how the multitasking layers are already lining up. Okay. So similar to reading, it's pulling together all the different concepts together and being able to hold on to that initial information that we had thought about and wanted to do. So typical classroom learning expectations. These are things that we expect most kids to do in a regular year, not a COVID year. But typically they're in a classroom with 25 peers, around 25 other children, and they have to compete for the teacher's attention with all of those other kids who all have their own unique learning things. They're expected to maintain the same pacing as other children, even when they're removed from the classroom for supportive therapy. So we have a lot of kids who are pulled up for physical therapy, occupational therapy, speech therapy. They do need those services in order to make the same progress in those domains. But they're expected to do all the academics that everybody else is working on, okay? Classrooms also assume a great deal of multitasking and active online information processing. So while they're in there listening to a lecture, processing and understanding all the information, keeping track of all the content, taking notes if they're in middle school or high school, that requires a lot of multitasking and information processing skills that are pretty complicated, right? Especially as kids get older. So when we're starting to communicate with schools about our children, about how kids with spina bifida are different than some other kids and have different needs, one of the things that we have to keep in mind is that while it seems like there's a lot of kids with spina bifida, especially in my world, I see a lot of kids, it's not a common medical condition. It is not asthma or diabetes for an elementary school that deals with these kids at all times. Based on the most current numbers, it's around 1,500 children are born per year in the US. And so there's a lot of school districts that have never met a child with spina bifida. And like we talked about in the beginning, there's a lot of variability. So even if they have had another student with spina bifida, there's no guarantee that their skill levels are anywhere near the skill levels of your child. And so think about this as coming from a medical perspective, that starting from scratch, that they have to understand the medical disorder and how that affects learning. And the school's job is really to ensure access to the curriculum and make sure that they support learning for the upcoming academic year. That's what IEPs are written for. That's what your third grade teacher's focus is. Third grade, that's it. Your job as a parent is to think about your child's potential, their ability to meet their potential, their ability to live independently. You're thinking life skills. How are they going to function as a 30-year-old? That is not your third grade teacher's concern at all. And it doesn't mean that either set of these goals is inappropriate, but they're not matched. And so when you're sitting in an IEP meeting or a parent-teacher conference, your discussion of what you would like for your child is just at a fundamentally different level than the teacher's is. And this is not a problem if your child is successful. It becomes more problematic when you feel like your child is not meeting expectations or making the gains that you would expect. Learning challenges change over time. So again, we talked a little bit about the changing expectations. Kids' ability to meet those expectations change over time too. So sometimes what we see as like initial challenges early on are not the things that we're dealing with later. A lot of kids who go into elementary school on IEPs go in under a physical disability. Mobility concerns are the biggest concern in early elementary school. That may not be the same in high school. And one of the other things that I wanted to point out is that the school's kind of bread and butter around diagnosis of specific learning disabilities is that's what they do. They see reading problems, they see math problems. They don't see that there are subtle changes in learning that may affect their progress across all of their domains. That's just not as common unless you have an underlying medical condition. And for some kids who have autism, who have more kind of consistent functioning across all domains with an intellectual disability, those patients or those children look very typical because they see a lot more of them. And so for a child with spina bifida that's got average verbal skills but pretty significant deficits in visual spatial skills doesn't fit within the typical kinds of accommodations that they provide. They're really starting from scratch and trying to figure out how to address your child's needs. So I'm not going to spend a lot of time talking about this. This is clearly something that's more specific per child, but in general, there are two different ways to receive services through the public schools. There are 504 plans that provide accommodations in the classroom, and not just the classroom, but also throughout life. You can receive 504, it's under the Americans with Disabilities Act. ADA accommodations can occur throughout the lifespan, including workplace environments, et cetera, even in adulthood. So these are things that they can provide, like preferential seating. If you're easily distracted by things around you, you don't multitask well, sitting in the front row, you have easy access to the teacher may help you overcome that difficulty. Or if you need support with organization, someone can help you with how to maintain all your belongings. Or you need extended time because you work at a slower pace, but you're able to generally keep up with classroom instruction. Those are all things that can be provided under a 504 plan. There's no fundamental changes in the way that you learn, just your ability to access some of the material. IEPs, or special education services, or PPTs, or whatever else in other states, special education services are necessary when your child does not learn in the way that most children are instructed. So if your child's development of motor skills has not been typical because of their medical condition and they require physical therapy, that's typically a special education service. If they have trouble learning to write because their cerebellum doesn't work, it's the same as for kids who are typically developing. They need occupational therapy to help them learn how to do the motor movements. That is a difference in how those children are instructed. And what we see with academics is when we need to break down information to teach it differently with more repetition and rehearsal or through a different strategy than most kids are receiving, that's when they start to receive special education services and are pulled out of the classroom for additional instruction or support. IEPs do have goals because the goal is to work your child off an IEP. They have trouble learning in the typical way that instruction's provided, and you can learn an additional set of skills to catch you up or be able to provide instruction in the same way that other kids are receiving it, it helps everyone. Helps decrease the cost for the school. It helps improve your child's ability to access the curriculum. So there are specific goals in every IEP around building skills to get them up to the same level as their peers, if at all humanly possible. That's the goal. And so occupational therapy, speech and language therapy, and physical therapy does not require an IEP, but they're often provided through IEPs because there are goals around helping those skills become more consistent with expectations. In general, there's learning strategies that you can use regardless of whether you're receiving a 504 plan services, an IEP, or any services at school. These are just general rules that tend to work better. Pre-exposure to content. And this is the way that we teach in college. It's not the way that we teach up to college for some reason. But that tends to work significantly better for many of our patients with spina bifida. Having an idea of what you're going to learn about before you walk in and learn about it is so helpful. Most of the time in high school, you go into the lecture first, and then there's reading reinforcement of the lecture. But our kids tend to work better when they actually read first and they have a general sense of what's coming, because then they know how to chunk and organize the information more effectively. Even if it's just keywords, having a sense of what we're going to talk about today, having a teacher who's a little bit more explicit and explains the topic before they dive into a lecture can be enormously helpful. Teaching's most efficient or more effective when you can highlight the topic and how that information relates to prior knowledge. So we start on Monday with a lecture about ecosystems, and then on Tuesday we talk about deserts. 30 seconds of that desert presentation needs to go back to the ecosystem talk and to say, remember yesterday how we learned about ecosystems. There's multiple different kinds of ecosystems. One of them includes deserts. Today we're going to talk about deserts. This is only one type of ecosystem. There are more, but that's what we're talking about today. So to kind of help categorize, chunk, and store the information more effectively. So then later when you bring up ecosystem, the child has learned deserts belongs in the ecosystem folder, but can also be its own folder of information, and the memory can store it in both places. Working to ensure that the child has actual comprehension of the material, not just repetition and memorization of the material, is essential if we want to build upon it later on. And then step-by-step progression in skill development is essential. So we also can't teach huge tasks and expect kids to just pick it up automatically through exposure. We need them to actually teach them in a step-by-step function where kids can learn them systematically and it becomes more of a consistent routine. So repetition is enormously helpful. Teaching to mastery is a phrase that I use a lot for patients with spina bifida. Teaching to mastery means that they understand and comprehend the task and have mastered it. A lot of the curriculum today, I would say everyday math usually gets the worst rap with this, but you introduce a topic and then you come back a couple weeks later and talk about it again, and then you come back later and talk about it again, and you get these little bits of information that are supposed to support comprehension. And for most typically developing kids, it does, because you've talked about it in a plethora of different ways, multiple different descriptions that helps you understand it. For a student that's memorizing and not comprehending information, all of those little bits are perceived as separate bits of information that are not related. So they're not able to build on the skills in the same way unless someone either makes the connection to what they've already learned, like we said earlier, or actually teach a skill to mastery. So repeated exposure that we use in some curriculums can really undermine learning if it's done in that fragmented way. And they really have to understand the content so they can build on it again later, okay? So teaching to mastery is something that we used to do with math facts in the way that people my age, at least, which is getting older now, were actually taught to do rote addition, subtraction, multiplication facts. And we're actually bringing aspects of that back in a lot of the classrooms because a lot of kids need to be taught to mastery to actually memorize the math facts to be able to have them securely rather than just exposure sometimes, because that isn't effective for a lot of children. One of the most effective interventions that I can recommend, because it's free, is teacher selection. Keep in mind that this happens at the end of every school year, not at the beginning. So you need to be having these conversations with the school in February, March, and April about what did you learn this year about the teacher match between your child and the teacher that they're placed with? What are the options for next year, etc. No principal is going to sit down and say, oh, that teacher's really disorganized. We shouldn't, well, professionally, they should not sit down and have that conversation with parents. Some may. But they all know instantly if you sit down and say, like, my child really needs to be with a teacher who's very organized, who uses a lot of repetition and rehearsal, who uses multimodal teaching strategies, who provides a lot of back teaching and looping with other content that they've already taught. That high school or that middle school or that elementary school principal can say without a doubt in about 3 seconds what teacher is going to be the best for your kid. And the beauty of this is that it's a free intervention, but it makes a dramatic difference for so many of our kids. And they can usually tell you by high school, there's certain teachers that they like and don't like, and it usually has to do with their level of internal organization. So the teachers who midway through the week are like, we're going to do something different, is like the arch nemesis for most of the kids with spina bifida who need the consistency and routine engagement every day in order to understand. Now, that being said, we need someone who's flexible and helpful instead of emotional and responsive when some of these things happen, because it can be somewhat traumatizing to have someone emotionally frustrated by your learning strategy. So I think I just went through all of these things, but naturally some teachers will provide a lot of the scaffolding that not all teachers do. And so we want to look for those people. Remote learning has increased some challenges for some kids, and then there seems to be some aspects that are a really good match. In terms of the remote learning, the quality of the program really varies widely between towns and school districts. Some kids are getting packets, some kids have live instruction every day, and there's a variety of differences that some kids are being exposed to. In general, the more live programming, the better, especially if it's small group. In terms of the computer-based programming, there are some benefits to this. The use of things like Google Classroom, which I suspect will continue after COVID, really helps to organize a lot of our patients with spina bifida. They know where everything is. It's all located in the same exact spot. They can go back and look at things 2 weeks ago, 4 weeks ago, and it's all exactly where they expect it to be. And it's marked submitted, not submitted, due, late, overdue. And it's very clear how to keep track of all of their assignments. And it's very different from paper. So while typing is sometimes a nightmare, and sometimes we don't get the production speeds and rates that we would expect if they were handwriting assignments, it is handy to be able to go through Google Classroom. And your teacher can even send you an updated email every day about what work's completed and not completed. A lot of the tasks are also self-guided, which means the kids can go back and rewatch a video if they need to, or have something read aloud to them if they need to, or to go back and reread a passage if they need to, allowing them more time to work at the pacing that they work at to be more successful. Now, this still means that prioritization is going to be important because kids do not have endless amounts of time all day. And it may be that art or something else at this point, especially with COVID, is not as important as some other topics. It's also important because although I'm not as familiar and comfortable with all this technology, for our kids, this is going to be the way that the future is. So a lot of things that are online, etc., are going to be essential for these kids. Some of the challenges are shifting attention between the classroom lectures, distracting background noises, everyone's need to have their dog on their lap, particularly in elementary school, and the actual work can be overwhelming, especially if there's 2 screens going on. Information processing loads and functional independence to complete a series of unrelated tasks can be really high. So like identifying task demands, initiating a task, completing the task, moving on to the next task can be really hard when you're not receiving any support from the outside world. And sometimes these tasks are not modified as much as they would have been if a SPED teacher could stand next to your child in a classroom. So that's something else to keep in mind, and it may be an accommodation you need to ask for during these times. And for a lot of the kids, some of the tasks that they can do, like Epic will read aloud to you, is amazing because the kids are more engaged and they get it done. But it's also disheartening because the kids aren't practicing their reading anymore. They're just practicing their listening skills. So we do need to make sure that we're keeping track of what things that they are doing that are typical and those things that they're doing that are a little bit atypical with the programming. And then maintaining focus for lengthy periods of time is really hard when there's no teacher engagement, there's no stations, there's no math games to keep you invested. So with the hybrid class instruction, a lot of families have asked me what the benefits of this are. I see a lot of them. One, it decreases the risk for exposure to COVID, which is clearly important. But removing half of the students from the class really allows for a more intimate learning environment with the teacher. And it allows for more accommodations within the classroom to help with access. So if the teacher doesn't have to teach to 25, but gets to teach to 10, that's amazing in terms of how much they can get through and how well they can target the needs of the kids sitting in front of them. The school environment allows for some of that consistent routine and support with learning, the match between that instruction and what you're doing online. And it allows for a little bit more information and access to those special education services that may have been provided if they were in the building full time. Now, these discussions about whether your child should be hybrid or full-time remote or full-time in the building, if that's offered to you, as it is for a lot of kids on level 3 or level 4 IEPs, is a family decision. I cannot make a recommendation about that. But what I can provide is information about how it may be beneficial to your child to be in that type of setting and receiving those types of supports. And so this is why I feel like even if your child is only going 2 days a week, it can be helpful in setting up established routines, giving them the language for them to complete the task, some familiarity, and a little bit more support. All right, so I've only got a few minutes left, but I want to run through some troubleshooting. For lack of a better term, I have always wanted a parenting guide. One was not dropped off with either of my children. And so I think this is challenging. That being said, if your children are typically developing, there's a lot of peer support because other people are having the same difficulties that you are. When your child has different learning challenges than most other kids, it becomes more challenging to identify what's the underlying problem. And again, I think schools' tendency to go back to what they're familiar with is hard. So if we see attention problems, teachers will often complain that kids can't stay focused during class. They probably have ADHD. That's often not the case. But they appear inattentive when they're overwhelmed and confused. So if they've been given too much information and they can't process and understand it, and they're trying to memorize, they are often completely overwhelmed and don't know what to do anymore. And emotional responses can also really derail learning. We haven't really talked about this extensively today because I kind of skipped over that domain. But anxiety requires a lot of multitasking, as do pervasive negative thoughts that happen in depression. And so if you're trying to manage emotional content and the learning, you're multitasking, and that load can make it even more challenging. Asking teachers to track when they're off task. Is it a time of day? Is it after they get back from capping because they've been out of the classroom and missed instruction? Is it always during math? Like that might help us identify what the underlying challenges are because it's not always just attention. It often has more of an underlying challenge with information processing demands and not knowing what to do. So our brain looks around for something that's familiar that we know what to do. I'll also hear a lot of complaints about inconsistent production. So teachers will say, oh, they can do it on Monday, but when we go back again on Wednesday, the kid has no idea what I'm talking about. That oftentimes is because of the lack of routines. So if we're relying on rote memorization, when we see it again, it doesn't look familiar, we don't know what to do. And so we have to make sure that information is well labeled and the kids really understand what it is that we're doing. It can't be labeled as like boring math from Tuesday, but needs to be labeled as like double-digit subtraction, that this is subtraction with borrowing, things like that, so that when those terms come up again, the kid can pull the file folder and say like, I've learned this before. And we have to monitor for fatigue. For a lot of patients, particularly those that have been much more complicated in terms of neurosurgical intervention, sometimes we will see fatigue in the afternoon because processing at the level that everybody else is just really hard. Epilepsy and anti-epileptic medications can also significantly contribute to fatigue, especially late afternoon. So that's important as well. Reading in the absence of comprehension, I talked about this a little bit earlier, but I'll often have people tell me that their kids can read, and they understand absolutely nothing of what they've read because they haven't processed it. So starting from the beginning, what's the title of the book? What do we expect the book to be about? What do we know about the characters? What might happen at the end provides the structure for kids to do. And teaching those specific strategies from an early age helps the child realize over time, like after they've read a paragraph, I don't know what's going on, I need to start again, as opposed to waiting till the end of the book. And then non-compliance with tasks. I'll often have parents tell me that their kids just don't try, or they're just dishonest and they don't want to get stuff done. That's often not the case. If we can be a little bit more clear with how information is managed, what the information means, and what we need to actually get done, we can help break down what's getting in the way, what those barriers are for task completion. I would say with a lot of kids with spina bifida, they tend to be more honest than kids who are neurotypically developing. And they typically only engage in actual deceitful behavior if they're completely overwhelmed and don't know what to do. So if we can teach double check strategies and go back and look at things again, that can really be helpful. So just in summary, there's always individual specific questions that we have about particular children because we're inheriting strengths and weaknesses from our parents in addition to all these additional risk factors from spina bifida. And so individual neuropsychological evaluations can really be helpful in better understanding your child if that's something that you're able to do. And at Boston Children's, we also meet with families for briefer consults as issues come up over time, even if we don't need a full evaluation. So hopefully that was helpful today in addressing some of those concerns about learning and information processing and how they impact executive functioning skills.
Thank you, Dr. Queally. I found that to be fascinating, and I think taking a lot of complex concepts and presented them in simple and accessible language with a lot of examples, which is so helpful. And so I think that this is a really valuable resource for parents and for educators as well. I think it comes to the table with, with best intentions, but maybe a lack of understanding. And so I think you've really broken it down in a simple way that we can all understand what the complexities and the layers of things that are happening all at the same time are, so that people have a better understanding of how they can maximize the positives and the strengths, as you so frequently presented, just to start from that perspective. So I found this to be such a valuable presentation, and I know that everybody in our community will as well. I really want to thank you so much for your time. I think this has been fantastic, and we are really grateful that we can include this in our October speaker series. So thank you so much.
Oh, you're welcome. It was my pleasure.
Thank you. Take care.
Bye.